Welcome everyone. Today we will discuss our research on the society outcomes of COVID-19 pandemic in Malaysia. Is there anybody who would like to begin?
Sure, I've been studying the data on the society outcomes of COVID-19 pandemic in our country, and I've noticed some concerning trends.
What kind of patterns do you notice?
I've noticed the Malaysian population had significantly altered their lifestyles and social relationships between the people and had presumably developed deep levels of anxiety, along with the fear of contracting the infection. Based on one study using an online survey, out of 983 Malaysian students, 20.4%, 6.6%, and 2.8% of the students experienced minimal to moderate, marked to severe, and most extreme anxiety levels, respectively, during the COVID-19 pandemic and lockdown period. For instance, female gender aged under 18 years, pre-university level of education, management studies, and staying alone were significantly associated with higher levels of anxiety.
Does anyone have an example of stories that support these trends?
Yes, I found a story that happened at a school in Kuala Lumpur. A student named Ain, who is struggling with anxiety. Ain has been having a hard time engaging with friends and social activities altogether. She may find excuses as she can't make plans with others. She will isolate herself and start to spend the majority of her time alone. Despite her struggles, Ain is determined to get the help she needs and making progress with the support of the counseling services provided by the school.
What do you think might be causing the increase in mental health issues among students?
Okay, there are likely a number of factors at play. One of the biggest issues is the pressure and stress that students are facing is due to school closures during the pandemic. According to UNICEF monitoring, 186 countries are implementing nationwide closures, impacting about 98.5% of the world student population. So, distant learning causes student workload, lack of sleep, online community, and so on. All of that will increase stress and isolation in students' life. Based on one of the largest national research projects, kids feel that they are more stressed than they were before the pandemic. They have more work, they are less engaged in school, and their relationship with teachers and other kids are strained.
That's informative. Are there any specific groups that might be more affected by these issues?
Alright, people of any age can catch COVID-19, but it most commonly affects middle-aged and older adults. The risk of developing dangerous symptoms increase with age, with those who are aged 85 and older are at the highest risk of serious symptoms. In the US, about 85% of deaths from the disease have been in people aged 65 and older. Risks are even higher for older people when they have other health conditions. For example, as happened to grandmother's neighbor who suffered from heart disease and was also infected with COVID-19, whose life expectancy was only a moment, and after a few days, she died.
Thank you all for your thoughtful perspective. It's so clear and right. I would now like to turn the discussion to how people prevent and control measures of COVID-19. Is there anyone who would like to begin?
Sure, I've been studying the data on how people prevent and control measures of COVID-19, and I've noticed the achievement of safe and effective COVID-19 vaccines are a powerful tool for ensuring public health and controlling the pandemic. COVID-19 vaccines are safe and effective at protecting people from getting seriously ill, being hospitalized, and dying. The data shows among infected individuals, vaccine effectiveness was 79.2% in preventing severe or critical disease due to COVID-19. There are currently 4 manufacturers for the COVID-19 vaccine approved in Malaysia, which is Pfizer, AstraZeneca, and Sinovac. These 3 vaccines have been assessed by the Ministry of Health to have met safety and efficacy standards.
I agree. Additionally, the most important strategy for population to undertake is to frequently wash their hands and use portable hand sanitizer and avoid contact with their face and mouth after interacting with possibly contaminated portable environment. To reduce the risk of transmission in the community, individuals should be advised to wash hands diligently, practice respiratory hygiene to cover their cough, and avoid crowds to close contact with ill individuals if possible.
In my opinion, we can prevent and control measures of COVID-19 through social distance. Social distancing is designed to reduce interaction between people in the wider community, where individuals may be infectious but not yet identified, thus not yet isolated. This is because virus particles can be present in the tiny particles that humans breathe out. So the first step is we must cover our mouth and nose with a tissue when we sneeze or cough. Besides, we must stay 1 meter distance from other people and stay away from crowded places.
I couldn't agree more. I think quarantine is one of the oldest and most effective ways of controlling communicable disease outbreaks. According to the article quickly published by the Cochrane Library, evaluating 29 studies, results indicate that quarantine can reduce the number of infected at rates from 81% to 44% and in the number of deaths from 61% to 31%. Quarantine helps to safeguard the public by preventing exposure to people who have or may have a contagious disease from people who are not sick.
I also think wear a face mask can prevent and control measures of COVID-19. Face masks have become essential accessories in protecting ourselves and others from contracting COVID-19. Face masks are made to contain droplets and particles that you breathe, cough, or sneeze out. A variety of face masks are available. Some face masks provide a higher level of protection than others. When wearing a face mask, it is most important to choose one that we can wear correctly, that fits closely to our face over our mouth and nose, that provides good protection and that is comfortable for us.
That's good. Can anyone suggest any preventions of COVID-19?
I agree with all. I think increasing testing capacity is another important point in preventing the spread of COVID-19 disease. For example, in South Korea, which acted quickly to administer free of charge and extensive public testing for COVID-19, drive-through testing was initiated for the first time. The ease of its application, reduction in the number of people who applied to health centers, and the capacity to investigate more people in lesser time appears as a successful strategy.
Thank you all. That's all the time we have. We have had a fruitful discussion on the society outcomes of COVID-19 pandemic in Malaysia and how people prevent and control measures of COVID-19. I hope to meet you in another discussion in future.
Thank you.